If you haven't yet listened to part 1, episode 13, Adolescent Medicine 101, What Parents and Clinicians Need to Know, be sure to go back and listen. This episode picks up where we left off and discusses raising resilient teens in the age of social media, eating disorders, looksmaxxing, and what labs really matter. We hope you enjoy. No, I think all of this has been just so great, but I want to piggyback off of something that Laura brought up a little while ago about the eating disorders in boys and how that's often so underdiagnosed, but I think we're seeing a lot more of it, especially with this like looksmaxxing trend.
Mewing.
Yeah. So all these things. So for listeners who are not familiar with this, with the looksmaxxing trend, it is kind of, as the name implies, maximizing looks. And it's a very large social media trend right now that includes things like mewing. Now, what is the mewing again?
I think the mewing is, it's like
the jaw, right?
The jawline, and you have to put your tongue a certain place in your mouth, and like you want to have like a very, blunted jawline.
Jawline, yeah.
I think though, so this actually, I became aware of this because I have, or had teenagers, and we travel with another family with three teenagers. And so we were on a trip, and every picture was or something with the chin and the fingers. And I think it started in the, oh my gosh, what is that guy's name? Andrew Tate, maybe. It started in that era, right? And thank goodness it moved away from that. But then I think individual influencers really took on this looksmaxxing. And I'm probably, if my kids hear this, they'll say you've misspoken.
You got it all wrong. You got it all wrong. You don't know what you're talking about.
Just take this, as this is Laura's version of this. But I became aware of, again, that boys were facing maybe what, many think only girls or women or younger women are subjected to. And so there's, this 6 to 8 to 10 to 12 pack abs, high cheekbones, certain jawline, and you have to be a certain level of maybe masculinity, and which is actually, to me, it's almost ironic because this version of masculinity is, I think, a new version of masculinity in the appearance, because it's much more about the appearance and maybe more similar to pressures that women had, or again, girls had earlier on, of like having like the flat stomach and having the high cheekbones and being more waif-like in the facial, in the facial appearance. And so I think it's a newer, it's boys are now being subjected to look more feminine in their face, but more masculine in their muscles, but their body needs to be super thin based on this looksmaxxing, and again, I honestly wouldn't have been privy to it, but being that I have boys and I have, then the families that we travel with and all of these kids that we all sit down and share together or joke around, that I was like, oh, what is this? Like, what's going on? Which made me look into it. And this started, I think, about 3 years ago. I think that's when I became more aware of it. And what I started to see in our practice, 8-year-old boys, 10-year-old boys, 13-year-old boys, and a ton of 16-year-old boys coming to us with anorexia, or coming to us with significant weight loss and a focus on their jaw and abs. They were following these YouTube influencers. And again, these kids, it could be an 8-year-old who's on YouTube watching something else. And again, all of these social media channels basically, they find the way to target the younger audience because they're vulnerable. And then these kids get sucked in. And so I think parents need to know, who are these kids following? What is the message that these influencers are sharing, right? And review their phone, review their iPad, go into their account and go through like what comes up on their screen. Sit there with them and then have a conversation and say, "Oh, let me listen to that podcast. Oh, let me see what is the message that this person is sending," because
Yeah.
this is rampant. And
Yeah.
and it just had, I think, another surge more recently because again, I've seen in the past 6 months, I've seen an influx of the younger boys coming in, the high school boys coming in. Um, and then there's this individual Clav, and again, I'm probably misspeaking, but he's one of these big looksmaxxers, right? And he recently was sent to the hospital. He was at a club and he passed out because he's doing too many drugs. So again, I think the standard, of that like this particular individual is putting this standard out there of like you have to look a certain way, be a certain way, but he's also doing drugs,
Mm.
right? And so
Mhm.
hopefully people realize that the standard that he's setting is, through plastic surgery, through drugs, through peptides, and he only feels comfortable in his skin
Yeah.
on these drugs, right? And so
Yeah, I mean, I think that as we're sitting here talking about this, the truth is that it's not very different boys versus girls.
correct.
It's
Correct.
really this show. It's this outward display of something. And when you really delve deeper into the inner, what's going on inside, um, it's just a show. And it's this superficial, like truly superficial, um, you know, version of someone and what is being prioritized and what is being maybe manipulated in order to appear a certain way. And it's really like when I think about, we have plenty of male patients. We have patients all across the gender spectrum with eating disorders, absolutely. But the inside story is very similar. There is not some magic difference between them. It's almost always quite similar. And I think really where there might be a difference is that maybe it's just getting missed, because I think
Yeah.
that boys and men are supposed to be athletic and supposed to be exercising and working out and getting big. And although honestly, I think in this day and age, that's really expected of a lot of women too.
Listen, I think there's just so many expectations on on every
Everybody, yeah.
adolescent, right? Like
Mhm.
they need to be everything and anything, and nothing actually fits all together, right?
No,
Like
it's
they need to be
impossible.
robotic. They need to be, artificial, like their avatar, right? Like, but that expectation isn't realistic. And again, I hope that our listeners understand through our conversation that, it takes a village to really help raise our children into healthy adults, right? Like you need the adolescent specialist, you need the dietitian, the therapist, you need active parents that are asking questions, right? And that
Mhm.
you need to be, I believe like the healthy type of parenting is it's like assertive but nurturing, right? Like I think there were like four boxes that I
Yeah.
remember. But so like you have to set boundaries and parent
Boundaries.
wanna do it with compassion and do it with love, right? But, like, the parent that doesn't set any boundaries, the kid is going to feel out of control. The parent that
Absolutely.
has too many boundaries, the kid is going to want to rebel, right? So, it's really how do you play that active role, but with compassion and not being the police person?
And I
And
think the perfection thing, Laura, I think that is hitting the nail. You cannot expect your child to be perfect. You just can't. They're not. And if you're expecting it of them, 9 times out of 10, they are going to want to perform the way you want them to. Or you're right, where they will completely rebel, one or the other, but neither outcome is really what you want. You just want happiness. You want self-assuredness. I mean, I think to me, confidence is probably what I want for my kids more than anything. I don't really care if they're not good at something. If they think they're good at it, great for them, Like I think that perfection is completely unrealistic and it's a recipe for disaster. And we all three of us do practice in New York City, and I think this location in particular is a very, very, very tough one. I mean, we see this all over the country and world. But I think the expectations of perfection among our patients are unreasonable, unfair, and a recipe for disaster. It's a setup.
Yeah. The one thing when you're talking even to the confidence, I think the one thing for all of us to be mindful of is it's also okay for a kid to do a sport or to have a certain body, right? Like, and maybe let's talk about a sport versus a body. So if they do a sport and they're not so good, I almost am like, and this is also again through the lens of having these teens and hearing my kids, maybe experiences of these things. It's like, okay, maybe you're not good at it, right? That's okay.
Yeah. Can
Like,
that be
you
okay?
know what? Like, I don't even want them to think they're good at it. Like, no, you actually suck, right? Like, it's fine, but I still love you. Like, you're
Totally.
awesome because, even when you suck at something, or you're still awesome, even if you got, a bad grade. So it's almost just like, and Risa, because I know you, like, I almost wonder if it's more about accepting themselves for the things they do well and the things that they don't do well, right? But I almost don't want to give them false illusion that they're great,
Oh my God.
right?
No, I
Like,
think that
so
is
when we say confidence, I almost think you mean, like, the way you mean confidence is really about, I want my kids to be real and confident in the fact that, like, maybe I don't do it well, but I'm happy still to, like, play it, right? Or
I
I'm
do it because I
right?
enjoy it and it's fun and it doesn't have to be for the outcome driven, competition driven. I'm the best at this. I do it because I enjoy it.
Right. But they also may not
Absolutely.
deserve to be on a certain team, and that's okay too, right?
Disappointment and rejection are important life lessons.
Yes,
I
exactly.
mean, how can you build thick skin? How can you even gain confidence if you haven't ever been let down? Like, you need to be able to
You
overcome.
need right.
Resiliency.
You need to fail, or you need to have experiences that are hard in order to develop resilience. Right. And maybe the thing as parents that we need to really be thinking about is raising resilient children,
Yeah.
right? That are realistic, but they can face the hard time. They can learn to use the tools that they would
Yep.
learn, in therapy, like, or, in nutrition, or things that you may teach them or the parents. But, I think about DBT. I'm like, every parent and kid needs DBT,
If
right?
I had a
Cognitive
penny for every
behavioral
time I
therapy,
say that
right?
to a family, if I had a penny, I mean, truly, I believe that every adolescent, it should be almost like mandatory, a law
I
that
think
every
if you get pregnant, you should be required instead
I
of
was going to
Lamaze
say once your
class,
kid turns 12, but
right?
pregnancy works too.
Right? I'm like a
Start 'em early.
pregnancy. The parents, instead of taking Lamaze class, everyone should do DBT, right?
And
Like, that should be it.
just for our listeners, because we're just getting off a tangent, dialectical behavioral therapy. We don't even have a therapist on this call right now, but I think just given the nature of all the patients that the three of us work with, we are so in tune. But dialectical behavioral therapy is a modality that is really helps an individual deal with distress. And
Yep.
it's that's exactly what
And
this
life is stressful and life is hard. And it's the way we handle those stressors, right? It's like when I set my mantra all the time, or like my intention with yoga, it's to move through life with ease.
Mm-hmm.
It's like, because it is so hard and it always will be hard. So for people to think, oh, life is easy, it's not going to be easy. Let's not set our kids up. And I think the reason that this is coming up is hard times mean you need tools. And if you have an adolescent, if you are an adolescent, if you don't have that toolbox, you need help. What are your tools so that you can face body image? Your body will change. Like, your body changes from birth all the way through death, right? So we have to be prepared for an ever-changing dynamic body. Your day to day will change, even though we have this structure from, like, maybe ages 2 to 4 all the way through, college. At this point, we have a structure of, you go to class, you do these things, but it is constantly changing. And so we have to be prepared for the change in the day, the change in the people, the change in the body, the change of food availability, the change in your stress level. And so you need skills. And if you don't have skills from birth all the way on, if we're not taught skills or teaching our kids these skills, they're going to use food and restriction or overeating or whatever it is. They're going to use their body to try to protect themselves or send a message to the world that they're in pain and need help.
Well said. It's really, I mean, we see it all the time, but eating disorders are coping. They really are. And it doesn't matter what the more surface level outcome is or what might sound like the goals are, but it's coping. It's coping with it's a way to cope with feeling not well, or too much, it's too hard. And so this is how we're going to handle it. And I mean, we see it all the time. A patient could be doing so well. Let's say we're dealing with a patient who has anorexia and is really, really doing well. And then something completely unrelated to the eating disorder happens and stress skyrockets and the negative feelings begin. And what's the first thing that happens? Restricting.
Yeah.
Diet,
Back to the coping
restricting
mechanism.
nutritionally. And
Mhm.
it's just, and patients will say it all the time. It's just been a really hard time. I couldn't deal with the eating disorder. I just needed to restrict. It got me through. And that is the way of coping. And if we can't teach our kids to cope with healthy mechanisms at a young age, then they develop unhealthy. And whether it's an eating disorder or substance use or self-harm or other behaviors. And unfortunately, social media is out there. So they're going to learn the negative behavior. So we don't teach them the positive ones.
Yeah. Yeah. I mean, social media. Laura and I were just in Salt Lake City at a conference where we presented, and there was a talk on social media and all of even with like the teen accounts and things, how just things are just proliferating and getting through. And there aren't really protections in place for kids and young adults for what they're seeing. And they don't have the ability to I mean, even adults, I feel like we don't have the ability to parse out the information, but they
Mm.
certainly don't have the capacity to really parse out maybe truth from fiction or what's helpful for them or what's harmful for them.
I think also just for people to understand too that every account in social media is very much a result of um kind of fixing, or it's all I can't think of the word for it, but it's not reality that people are paid now. They pay influencers to act a certain way and to then go on their account and say something,
Yeah.
right? So people pay people to comment on their social media, right? There's all these AI bots now that do, again, that will make the comments or, will suck in a certain type of person. But the word that I'm looking for is curated. Like
Mm.
everything is curated. So if it's an
Yep.
influencer, if it's, a food company, if it's, what you seem to be as just an individual, everything is curated, and even the responses many times are curated. Right? Or again, it could be someone, like myself that, you're paying somebody else to write um, your post on some type of social media, right? That it's not even authentic at this point. Um, it's just a marketing scheme. And so
It
people that are paying attention to social media to get their information are really being led astray, because it is just it's like reading the magazine. It's like they're all commercials basically, right? That are trying to grab the
absolutely.
adolescent and pull them in, right? And again, it's targeted at people of all ages, but the adolescent is most susceptible because they're on it all over the time, and they're actually being targeted by the um you know by Meta and all of these companies, right? So
Well, and they don't have the frontal lobe
Yep.
capacity to really understand. I mean, sadly,
Correct.
I think many, even adults, aren't able to decipher social media
Correct.
the way that you're explaining what it really is, Laura. But yeah, I mean, an adolescent takes things at face value. An adolescent is extremely concrete. An adolescent is extremely sort of self-centered in that sort of the stage they're in life, where everything pertains to them, and it really. So when they read on social media that you have to mew in order to make your face look perfect, that is something that is taken verbatim. That's what I need to learn how to do. That's how I need to present myself. It's about me, and this is what I need to be. And it's just, and it could be and it could be complete nonsense. It could be an AI bot making something up. Tomorrow, the trend is you need to, flare your nostrils, and like that's it like doesn't. It's totally, oh God.
So what is so talking about like the prefrontal cortex and I think about age 25 is when the car rental companies allow you, or above age 25 allow you to rent your car, right? And that's because the brain isn't fully developed, I believe, until about 25, right?
Yep.
So can you just speak a little bit more to that? And I also know that with our clients with eating disorders, they don't have that cognitive ability or flexibility
Yeah.
when the brain is malnourished.
Oh
And
my
so
God.
I think it's really important for, again, our parents and our adolescents, our listeners in general, to understand that if you're not eating enough and also being at this age of adolescence, your brain is not flexible, right? For you to be able to not think in these concrete, you're only thinking in this concrete way, or can you go into it a little bit more?
Absolutely. I want to just, you asked a lot of things in that one question, but I want to highlight what you said, which is about the undernourished brain just not being able to function at capacity. I mean, so every adolescent, correct, the brain is not fully formed. We say until 25, but I mean, really, that's just when the prefrontal cortex sort of solidifies and is able to move toward higher level thinking in the more abstract sense. But experience counts for everything. The older you get, the more you learn, the more connections, literally, you are making neuronal connections in your brain that are growing your brain and increasing your ability to think and reason. When you are malnourished, your brain does not work for so many reasons. It's so complicated. And I think sometimes I think it's helpful to sort of think of us as just a computer with a ton of connections. Like that's really what we are in certain ways. And those connections rely on neurotransmitters, which are little molecules, proteins that are speaking to each other, more or less, sending signals to each other, and that is relaying a message. So whether it's the signal from your brain when you touch a hot stove, the signal travels to your hand and then back up to the brain and says, ow, pick your hand up, right? So that's what we're talking about. But in order for that signaling to happen, there are all these actual molecules that are doing the work, that are sending the signals. And, neurotransmitters are things like serotonin and dopamine and norepinephrine. These are terms that many people have heard of, but they're made up of proteins. And if you're not eating protein, this is what I say to my patients all the time. I say, okay, let's talk about serotonin. Serotonin is like a happy molecule. You need serotonin to feel calm, to feel safe, to feel happy, all the things. If your body made a priority list of all of the proteins that are important, yeah, serotonin's on the list, but it's toward the bottom because your body doesn't necessarily need to be calm. It doesn't necessarily need to be happy. It needs to be beating your heart, and it needs to be, expanding your lungs. It needs to be surviving. And so if you are depleted of resources, guess what your body's not going to bother to make? Serotonin. Or so all of the things that your body and brain need to function, when you are starving or when you are even just a little bit undernourished, it's going to prioritize the absolute essentials. And so well-being, higher level thinking and processing, memory, all of those, you know,
Functions.
functions, thank you,
Mhm.
are less important. Finding food is frankly the only thing that your brain is thinking about because that's what it needs. And so for, a lot of our patients who are high achieving and want to be scoring a certain way or playing a sport to a certain degree or all the things that they're trying to do, when you're not nourished, you cannot function to your capacity and the brain cannot think.
And that's
Very
another thing actually for parents to look at, right? That like if your kid's sport, right, if their ability to play in that sport suddenly changes, like think nutrition, right? Like
Oh my gosh.
are they
Yes.
eating enough? Did they change their intake? You know, my boys, I remember when they were getting more focused on these sports, it was like, how do we figure how much that we need to increase our intake? And they couldn't find it, and that's why they developed their Sports Plan Pro because
Oh,
they
love
didn't
it. I
have
love it.
right. They couldn't find any evidence-based place to get information for adolescents on how to get in enough nutrition and then how to gain weight for their sport. Right. And so, and not everybody has the ability to have a mom as a dietitian or to afford a dietitian, right? And so it's really important that we remember that, whether again it's an athlete or just an adolescent in general, like they don't have the ability to make decisions or to practice flexibility if they're not eating adequately. And there is something that the three of us all use, which, I think Risa, you and I were just on a text with a psychiatrist the other day who was saying to us, what do you use to test to see if the person is eating adequately? What's that thyroid measure? So can you speak a little bit more to the T3
Oh,
that
sure.
we collect? I think you have the best explanation of like why we look to this particular biochemical marker as dietitians and or physicians to better understand, is our client taking in a sufficient amount of nutrition in the past few weeks.
Right.
And even like that client that you or patient you originally shared about, right? Like when you get the labs back after you've because you collected that in the meeting, you'll be able to look at those labs and say, you know what, maybe so and so is telling me that they're eating enough. But when I look at this measure of T3 and I see that they're at, a 45, wow, that's really too low. And I'm going to call her back sooner.
So I love that you just brought that up. And, okay, so I told you at the beginning that in some ways my job is easier because I have the data and I'm the one who gets to send the lab tests and everything and do the vital sign measures. And, we could have a whole podcast on the physical exam and lab markers
Next
in
time you'll come
nutrition.
back.
Yeah,
For
right.
part two, we will
Part
do
two.
vital
But
signs
so
and physical symptom. Mhm.
totally. And so T3 is one of my favorite markers. I just love
It's one
it.
of our favorite markers too. But
So,
everyone thinks we're crazy when we request. Just so you
yeah.
know, also, just so our listeners to know, is dietitians are trained to read biochemical markers, right? We spend all this time in an internship working with physicians,
Mm-hmm.
reading data. We read labs every single day. People get so upset when I request for labs, and sometimes therapists are like, that's not your business. I said, that's what I'm trained to do, right? You have a clinical rotation. I did 9.5 months just in clinical, just for nutrition data and collecting and understanding what does it mean for a ferritin of this level? What does it mean of the T3? Why do I have to look at the B12? So share with us,
I
Dr. Lee.
Oh, I was gonna first sing your praises, you dietitian. I find that I think sort of like adolescent medicine, I think dietetics is not really well understood in the general population. I think people are like, why do I need to just like list what I eat for someone? And it's really so much more nuanced than that, really understanding, especially for a lot of our patients who think they're being so healthy
Mhm.
and want to be they're in their best fit state and they're so wrong as to what they think is nutritionally healthy. And so I
Yep.
find that part of your role just incredible. The T3. So the T3, triiodothyronine, is a molecule released from the thyroid gland. The thyroid gland is a metabolic endocrine organ in your neck that sort of sets the pace of your body. It helps you increase or reduce energy, increase or reduce your temperature, increase or reduce the speed of functioning, let's say, of your heart or whatever. And it sort of like, I think of it as it sort of looks at the body as a whole and how well the body is and can adjust accordingly. If the body's doing great, the thyroid's functioning really well. If the body is not doing well, whether it's because you're chronically ill or because you're acutely ill, you developed a severe case of influenza or pneumonia, the thyroid will respond accordingly. And there is actually something called sick euthyroid syndrome, where the thyroid itself is still functioning. If someone were to just go into an average doctor and get their thyroid levels checked, the thyroid looks like it's functioning. The typical TSH and free T4 that are measured are normal, but the T3 becomes low. And that is what is called sick euthyroid syndrome. And basically, it is a reflection of something's going wrong with this person's body. And what we've learned is that if there is nothing else wrong, if the patient does not have an acute or chronic illness, if the patient, is otherwise functioning totally fine, then it is an excellent marker of nutrition. And it's really, really helpful for me because it responds very quickly to external nutrition. So if someone eats very well, so I say this to my patients all the time, if I walk down to the street and picked a healthy 15-year-old girl that eats completely well, robustly, and lives a healthy lifestyle in terms of movement and sleep and all the things, their T3 would probably be 120, 130, 140, in the mid 100 to low 100s is where a T3 typically lives. And if I basically under 100, I start to say, that's a little unusual, but some people might live in the 90s. Okay. Under 90, I'm like, something's up here. Mm-hmm. Under 80, finally the lab flags it as abnormal, which I don't really understand why the lab, like the actual Quest and LabCorp lab values allow a T3 to be as low as they do before they flag it. I have my own values. And under 80, something is wrong. Either there's an acute illness that I'm missing or there's something nutritionally going on.
Right. And so I think that's a really good point that, when we look at our lab values and we get them back from Quest or any of these places, that just because it says it's normal, it doesn't actually mean it's normal. And the other thing that I want our listeners to recognize is that you don't just look at one lab in isolation. You look at a whole bunch of labs together, right? Because one may be off or may not be off, but you have to look at the whole picture, because if one is a little bit down and one's a little bit elevated, you might need to look at some other labs to see, are there antibodies or are there, it's a whole story, right? There are many pieces to our puzzle. And so again, I think going back to your holistic view, and we're very much into this holism and always have been, because, and it holds true for the person, but it also holds true for when you're looking at biochemical markers, right? That you can't just look at one in isolation. And the other thing is, when you're looking at something like the T3, if we measured it this week and I, had a client going in to see you, right, that I'm referring, they say, oh, I know Dr. Fridy is going to measure my blood work this week. Our clients are very intelligent. They're going to eat very well before that appointment or that week before. So if you're not checking, right, but so then they're smart. So then they'll say, well, now after I've seen Dr. Friday, I'm not doing shit until I, have to go back to see her. And then they'll go back into restriction or doing whatever they need to do, right? Or whatever they want to do. But if you're testing these things regularly, you keep eyes on them and oh, right, because a lot of the maybe pediatricians or people that don't specialize in eating disorders that I work with don't recognize the value in repeating the labs more frequently.
Mm.
And then we miss it, right? Because the child or the adolescent that has the eating disorder, or again, just adolescents in general, they're pretty savvy. They know how to work us, and they can
Oh, they
read
know how to work
all this info online, right? Through, especially now through AI and whatnot. And so they know how to work the system. So you have to be taking these measures regularly. And I think the other thing is we want to take them regularly, and you want to take, you know, a good amount of them. And something for Shannon and I, we need these measures also to be able to speak to our patients and our clients and let them know your body is communicating, it's suffering. And a lot of physicians, I think in general practitioners think, oh, you don't need these labs, Laura, or you don't need these labs, Dr. Herbert, right? They're like, you're requesting and making this person, pay more, or you're making insurance pay more. And I say to them, no, we do need them, because guess what? Your adolescent is concrete, just like you said, right? They need to see black and white. Nope, my body is suffering. And once Shannon and I have that evidence to say, look, your T3 is so low. Look, your leptin is at a 1. Or, oh my goodness, you know what? You have no iron stores left. No wonder why you feel so fatigued and lethargic, right? They need to see the evidence, because if they can have concrete evidence, we help to make them move those steps forwards. Whereas many times they don't believe us. They think that we're just parenting them
Absolutely.
if we don't show them the evidence.
It's also really nice to have other numbers besides the number on the scale. The number on the scale in our culture has so many emotional underpinnings, and it has so much meaning, and it might as well be a clothing size. It's just, and so this is another number that helps, that doesn't have a context for a patient to really judge in a way that is nice.
I always think about the internal, like what their body is telling us versus the external. Like the weight sometimes can still be super external. So we're always saying, like, what is your body telling us internally?
The
And
weight
using that as a
is honestly a terrible measure in many ways. I mean, if you eat something really salty, you're going to weigh more. If it's the morning versus the afternoon versus the evening, if you're wearing clothes, if you're not, if frankly, if you're pushing down on the scale in a certain way, I mean, the weight is much less accurate, one scale to a different scale. So I like looking at these numbers, and to sort of bring it back to that patient from the beginning. Anybody who's listening to this podcast might be like, oh my God, is that really it? You just left her at a 17-pound weight loss? But no, I did a very extensive lab workup, because I said, first of all, is there something else going on that I'm missing medically, that she's lost 17 pounds unintentionally? Like, does she have, undiagnosed diabetes, or God forbid something worse? So my lab panel for this patient was really extensive, with inflammatory markers and thyroid studies and, celiac marker. Is there something else going on that this patient has lost 17 pounds? And reassuringly, her labs were beautiful. Everything was perfect. She doesn't have an ounce of inflammation in her body. Her thyroid is perfect. Her T3 was actually really excellent.
Again, you'll check it in a month, right? To
month.
see again where is that T3 amongst other things, and go from there.
Yeah.
Can you just explain the T3? I heard you explain this in one of our collaborative sessions that we shared with the client in the session, and I think you explained to them how the body makes the T3, and I think it was, and why. Again, and why it's so relevant into, I don't know if you explained that already, but I feel like there was one thing that we're missing. I don't remember what it was, though.
I'm thinking about what I might explain. I think I would probably say, I mean, I think I said it, but just basically that the T3 is sort of your body's response to how well or not well your body is.
Does something else make the T3, or the T3 make then something
Yes,
else?
so it's
Something
converted.
around that.
Okay, so
That's it.
basically you have these other thyroid. So T4 is typically we will measure the free T4. Sometimes these proteins are bound to other proteins or whatnot. So when you measure them in the blood, but T4 is often converted into T3 in the
Right.
bloodstream, and T3 is the more active hormone that can then go do things. And so when you're really unwell, the body isn't converting T4 into T3. So it actually gets converted into something else called reverse T3, which is a non-active metabolite that doesn't really do anything helpful. And so in starving states, your reverse T3 is actually really high. So if you're looking in the literature, there might be articles about high reverse T3 in anorexia or really low T3. It doesn't matter. They're really just the opposite of each other. But I generally don't necessarily get that deep into it with the patient. I probably was explaining that to you guys as clinicians.
I think it could have been an older patient, you
Yeah.
know. I feel like
Sometimes when my
sometimes you
patients are
know,
really interested.
yeah, I was going to say no, because it was definitely it was yourself, myself, and this patient, and you were explaining because also I think, you know, we have highly intelligent patients, right? And again, sometimes giving them the education really helps to move the dial in terms of, oh, now I understand how my body's working internally, and therefore I actually will make a change, and therefore I will feed it.
I mean, for so many of these patients who are motivated, look, there's so many motivators, but many of them are motivated by health. And a lot of times they sort of end up in this place they're in, like inadvertently trying to be healthy.
Yeah.
And it gets totally out of control. But if you were to look at all of the measures, when I always say this to my patients, my age group that I work with really physically should be the healthiest time of your life. The body is at its highest reproductive capacity. It is physically so fit, especially in your 20s. And these poor bodies of the patients I work with eating disorders, their bodies are not functioning. And it's really a shame.
So we
And
want to be super mindful of your time, and we thank you so much for being with us here this morning. And I think we're going to have to do a part 2 here about so many things, but if there was one thing that you wish every parent or provider understood about adolescent eating disorders, what would it
Parent or provider? They're so different.
be? Pick one. Let's do one for each.
Let's do parent.
And then I might have a request, but okay.
Oh, okay. Oh,
I
gosh.
think I know your answer, right? Because
you
this
do?
was actually in the conversation that you and I had, I don't know, maybe 4 weeks ago, 5 weeks ago, when I was referring someone to you, and then we were talking about another client. What you said to me actually was, Laura, I wish the pediatricians and I wish the parents were able to see what I see. Because you're an adolescent medicine specialist, you shared with me that you may see the kid at age 10, but you're also going to see them at age 30, right? Or age 25. And if the client has an eating disorder, right, at age 18 or 16, and it's not addressed and they don't enter into recovery, you will see them at age 20, at age 25, at age 30, still with an eating disorder.
Yes.
And you said to me, and it just really hit home, right? That like you're in a privileged state to be seeing the individual through all of these stages. But
Yeah.
most other physicians don't have that privilege to see the client through that time period, right? Maybe a family medicine specialist.
Right.
It is absolutely important for parents and physicians to make sure before this kid turns 18, right? Before they're off and on, before they head off to college and we don't have eyes on them, and parents aren't even allowed to, you know, demand certain medical care.
Yeah.
We get them to a place of recovery or get them to a place of at least being fed so that the brain can continue to develop and that they can move from that concrete place to a flexible place, because otherwise they're going to end up having this eating disorder forever. right? Like that's a very likely possibility if they don't address it in adolescence. Am I misspeaking or misrepresenting
I mean,
your?
it's a perfect answer. And it's so true that I think the biggest risk of an eating disorder, honestly, is chronicity. It just, if it's not dealt with, it becomes a chronic, lifelong problem and it steals you of life. I mean, really sick patients with eating disorders, and there's a whole spectrum and there's all different types of eating disorders, but they take away the ability to live life to the fullest. It's having a chronic illness and it's not fair. And I think, it's interesting because what I was going to say when Shannon first asked me, I was thinking more of like the younger kids, like preventive,
Hmm. Mm,
which I was going to say, from doctors and patients or, healthcare providers and patients, I think mixed messaging is a really big problem. Is if you give your child or your patient this message that they have to be perfect or they have to be thin or they have to be healthy, and you're expecting that, but then you suddenly start noticing a problem and then you want to take care of it, you've really done a disservice here by setting them up for not being able to. I mean, we sort of talked about this, just not being able to cope with not being perfect. So I think the messaging has to be right from the get-go that you are who you are. Be proud of who you are. You're going to be great at things. You're going to be not great at things. Your body is going to be your body. It's going to be, and it doesn't have to fall into some perfect box, because if you try and turn yourself into a perfect, entity, you will fail and you will be sick.
yeah.
And then, yes, if you don't manage this early on, it's going to turn into something really bad.
Right. So I think this is why I love you, and this is why we share so many individuals. Prevention, right? Like as parents or as educators or professionals, right? Like, can we send out the message of prevention? And then again, if someone is ill, how do it's making sure that we address it rather than sweep it under the carpet and let it build,
Yes.
especially thinking that it'll miraculously go away.
Yes.
Because in your experience and in our experience as well, what we see clinically is that if it's not addressed early on, this will be a lifelong struggle, of managing food and body and all the complications that will come along with mental health and or eating disorders, whether it's, you know, um, a GI issue that becomes this lifelong, obsession, whether it's, um, you know, something else that, again, maybe the eating disorder was covering up for. Maybe there was a trauma that needs to be addressed, right? So I think just in the way that we approach our clients and our patients, always listen, be curious, ask questions, and never dismiss, right? Never say, oh, no, no, you're fine. It's like, just keep asking questions and
Yeah.
always say the door is open and that I'm always here for you, and validate, right? Just always be that person to listen, maybe ask more questions, um, but don't dismiss. So, Risa, thank you so much for helping us today and
Yeah,
shedding light on
so much.
adolescent medicine and just, your experience, and I think your experience with Shannon and I, and how we all work in this much more holistic, whole person approach. You know, um, I think we're also lucky to get to do what we do, and I feel so privileged just to work with the clients and also see many of the clients that do have eating disorders to actually get to see them to full recovery. And I know Shannon and I had been talking about full recovery earlier, but again, you have children, we have children, so we're mindful of time. So we hope that you come back and we can talk about complete recovery and what that looks like in
Love
your
to. And
experience.
and do our vital signs and, physical exams.
Totally. And complete recovery is why we do this, right? Because you really can recover and it's the best thing in the
Yeah.
world when you see
It
patients
is, it is
health.
the most, I mean, for me, it's like that's the high. Like, that's the reward.
Why? It's
Well,
the why. I think a lot of us do this.
it's so beautiful. And, I have clients, and Shannon, has clients that we get to see them also when they then have, babies, or they have
Oh, yeah.
families, and then their kids come to us. Or, I mean, it's like somebody recovers, but then, it's like they'll send pictures of their babies, or they'll
Ugh,
send pictures
one
of
of
their
my patients
wedding,
one
or
of my patients just got into medical school. She was 12. I mean, she was so sick back in her day, and she's just, and I'm like, you're going to be a doctor and like go. It's
oh
like,
my gosh, it's
I cheered.
so,
I know. It's
yeah.
incredible.
Or they become therapists, or
I wish
dietitian
it
clients
was.
become therapists. So, yeah. All right. Thank you
So
so much
Thank
for
you
thank
so
you
joining
so
much.
much.
This
This
on
was
was
an
so
Cupcake.
fun. I could just chat with you ladies all
all
day.
day, right?
All
So
day.
just
Thank
tell
you.
our listeners and our viewers where they can find you online, and,
Absolutely.
any other information. I don't know, like if you want to share your Instagram.
So my practice is called Tribeca Adolescent and Young Adult Medicine. We have a website. It's tribecaayam.com. Come and visit us. You can call me. You can email me. You can text me, fax me, patient portal message me. I'm very accessible. Guess what? I'm not the best at social media because I don't have time. I'm on it. It's there, but there's like no content. So come visit me in real life. And but my website has all my contact information, and I have another 2 physicians in the practice and an amazing practice manager. So come visit us.
Well,
Amazing.
yeah, thank you. And I
Thank
hope
you.
that, you know, whether or not people can see us individually, that people can just become more educated, and now they have this podcast to listen to, so that they can start to ask questions or be more curious around, like, how do I want to show up differently, whether they're an adolescent or a parent. So again,
Absolutely.
thank you so much
Thank
for
you.
your time and all the collaboration, and education that you give Shannon and myself and Paige, right? Because we're always learning
Likewise.
new. So, all right. Namaste.
Thank you for being a part of Eat Kale and Cupcakes. If you enjoyed today's episode, be sure to subscribe to the show so you never miss another episode. If you found this conversation helpful, please leave a rating and review. It helps more people find the show. And don't forget to share this episode with a friend, family member, or healthcare provider who might benefit from it. Until next time.